just takes 15 points off and just read through the whole list and assess the patient. Hi, my name is Zach. I'm going to be your nurse today.
Nice to meet you.
I'm going to do a quick head-to-toe assessment. Can you tell me where we are right now? What city?
Thyroid.
Alright, and what year is it?
2017.
And who's the president?
Donald Trump said
And can you count for me from 9s?
Oh man, 7s was better. 9, 18, 17, no, 27, excuse me.
Alright, we're good. You're good.
Figured it out, dang it.
Alright, so next. What's in there? Skin. I'm going to go ahead and just take a look from head to toe at his skin, looking for lesions, abrasions, any cuts, sores, deformities that are obvious. I'm going to go ahead and feel on his head, on his cheeks, everywhere for temperature. Everything is warm. Turgor is good. Can I see your fingers? Your refill is good. And can you touch your fingernails to each other for me? There we go. I see a little triangle, so there's no clubbing. Texture is smooth and even throughout. No differences and changes. Back its hair, evenly distributed. There's no lesions or any kind of bumps. Is there any pain when I press on your head?
Nope.
Okay, it's free of debris. Clean. I'll put it in nails. Expected. Condition. Clubbing. Halfway flow. Look at his head and face for symmetry and again any kind of deformities. He has facial hair, but it's clean and free of debris. Feel your sinuses. Tell me if you feel any pain.
Nope.
No pain?
No.
Okay. Can you open your jaw for me? Or what? There we go. Try to close. And can you chew for me? Okay. And so here's a cotton ball. It feels like this. You want to close your eyes and tell me where if you feel it, if and when?
When? Yes. Yes.
Okay, thank you. Go ahead and open your eyes. Can you raise your eyebrows real high for me? Close your eyes real tight. Scrunch your nose. You wiggle your nose. You blow your cheeks out. Smile real big. There we go. You open. Okay. Go ahead and look at his neck veins. I don't see any kind of distension. You turn your head a little bit in that direction. Turn the other way. No, so no JVD. No distension. Can't feel any kind of distension or problems with his veins. Feeling his trachea for tracheal tug. There is no tug. Go for his lymph nodes, and then I'll do his thyroid. So, you just take a small sip and don't swallow it until I tell you. Turn your head this way.
And go ahead and swallow.
Same thing, take a little sip and don't swallow. Tilt your head the other way. Then go ahead and swallow. Okay. Can you turn your head this way for me? And the other way? You show your shoulders. Alright, and turn against my hand. And shrug your shoulders. So what I expect is eyebrows, eyelids, sclera, irises, and pupil. No redness. Pupils are about 3 milliliters. This distribution of the hair is even. Alright, just gonna feel around your eyes. You tell me if you feel any kind of pain or discomfort. No pain or discomfort. I'm gonna give you a card. Just hold it in one hand and close. Put another hand over your whichever eye. Yeah, so put this hand over your left eye.
You mean this side?
Yeah.
I'm gonna do my left eye first.
Okay.
I'm gonna take forever.
All right. And just read the lowest line that you can read.
Four, 2, 6, 7, 3, 9, EWM, OOX 3, 1.
You do the same for the other.
Four, 2, 6, 7, 3, 9, EWM, OOX 3, 1 plus.
So go ahead and cover one eye again for me. And just look straight ahead at this finger, and I'm going to wiggle my fingers, and you tell me when you see my fingers wiggling, okay? What's this finger now? Watch this one. Okay. All right. Follow this finger. Just watch it. Okay. I'm going to shine a light into your eyes. You just look straight ahead of my nose if you can. And can you cover one eye for me? Follow with this finger, and when I say to uncover your eye, go ahead and uncover the eye, okay? Uncover. And do the other eye. Same thing, just follow this finger. Uncover. Interesting. There's a problem with the muscles in your eyes. The one that you have closed might not follow the same, and so when you took your hand off, it might jump up.
Really?
Really? It's kind of sad, but yeah.
Oh.
It's like a lazy eye kind of thing. Oh. And can you just follow my finger with your eyes? Okay. Oh, and more. Next, I would expect to palpate the ears. Any pain? No lesions, abrasions, any kind of debris. Nothing on the inside. Nothing on the inside. You go ahead and just cover one ear for me. I'm gonna whisper something. You tell me what you hear, okay? Close the other ear. like this. I'm gonna bang it. It'll vibrate. Stick it on top of your head. You just tell me if you hear it any differently in one ear or the other. You hear it more in one ear or the other? No, it's equal. So now I'm gonna put it on. I'm gonna bang it and put it on this side. And this side, one at a time. So we'll go from here to here. You hear it? Okay, tell me when you can't hear it anymore. And then I'll move it to your ear and tell me again when you can't hear it.
Okay. Okay. Okay.
You still hear it? Next, I'm going to inspect his nose, mouth, and throat. Looking at his nose for any obvious deformity, any kind of deviation. There's no wounds or lesions. Can you tilt your head back for me? And look inside of his nose, just for any kind of debris. Free of debris.
Pretty time to sneeze.
Yeah. I feel his nose just to see if there's any kind of deformities that I can feel. Nothing palpable. Nose is symmetrical along the ridge down. Looking at the lips, there's no cracking. They appear to be without lesions or any other obvious deformities. Can you open your mouth for me? We'll look inside for any kind of, in the buccal mucosa, looking at the teeth for any kind of dental caries or debris or missing teeth. You've got all his teeth, tongue, everything is pink and moist. Can you stick your tongue out for me? And go, Alright, so uvula rises midline. Tonsils are grade 1. And let me see your tongue. I'm going to just grab it and I'm going to move it one side to the other. So the base of his tongue is free of any kind of lesions or debris. I'm going to go ahead and swap my gloves. Can you stick your tongue out? Yeah?
No.
Okay, thank you. Next, I would observe his chest and lungs. Can you go ahead and sit so that you're good right there for now, I guess. I'll tell you when to move. Inspecting his chest, there's no obvious deformities or lesions. Also, just noticing his head is midline between his shoulders, symmetrical, similar to his chest. No obvious deformities. He has hair, but it's evenly distributed without any kind of obvious maldistribution in hair growth. And go ahead and listen to his chest. Deep breath. Listening the gray key pattern. Can you sit so the camera can see your back?
Yeah.
Again, deep breaths. Lungs are cleared off rotation. If I had heard anything abnormal, I would have tested for bronchophony, egophony, and whispered pectoriloquy. Respiratory rates, about 12 breaths per minute, unlabored, no use of accessory muscles. Anterior posterior diameter is appropriate and equal. No barrel chest noted, no retractions. Go ahead and feel your chest. Tell me if anything hurts. One more time, could you have the back? Yeah. Can you take a deep breath? You said 99.
99.
Nice and clear, 99.
99.
And again.
99.
So I'm going to go ahead and you sit straight up for me. And I'm going to hit my hand on your back. You tell me if it hurts. No pain? Just stay there for a minute, please. Okay. If you could just lay down on the bed for me, I would appreciate it. Next up is Hardened Vessels. At the second intercostal left or right sternal border, we have the atrial point of listening for the heart valve. At the second intercostal left sternal border, we have the pulmonic valve. Third intercostal left sternal border is the Erb's point. Fourth intercostal left sternal border is going to be the tricuspid area. And then fifth intercostal mid-clavicular is going to be the mitral point of listening. S1 is the sound of the atrioventricular valves opening and closing. S2 is the sound of the semilunar valves opening and closing. You will hear a systolic murmur after S1 and a diastolic murmur after S2, or diastolic after S2. If I heard anything abnormal, or if I had difficulty hearing the patient's heart, I would ask them to turn onto their left side so I could hear more clearly. Inspecting the precordium, I don't see any kind of heaves, lifts, any kind of abnormal signs of infirmity. Feeling at each point. Switching to the bell. Go ahead and palpate his temporal and carotid arteries. Listen to them as well. No thrill or bruising noted. So we'll feel his rest of his arteries, his brachial artery. You put your arms out for me. Awesome. Radial artery. I don't care about that one. So we'll come down. Thank you very much. Can I see your stomach? Next up is the abdomen. So we're looking at the stomach and the umbilicus. I can see that the umbilicus itself is clean. It has hair distributed around it without any obvious maldistribution in hair growth or pattern. There's no obvious wounds or deformities, lesions, cuts, scrapes, scars of the sort. I am not able to visually see any peristalsis. And the patient has emptied his bladder. Yes. Go ahead and listen to his stomach. You know, when I feel your stomach, tell me if it feels tender anywhere. I'm going to feel his aortic pulse over deeper. I'm going to feel a little bit deeper in the rest of your stomach. Still no tenderness. I'm going to feel for his liver. Go ahead and take a deep breath. In and out. And begin to sink. Now for his kidneys, I'm feeling. And one more breath. Next, we'll go over range of motion. Can you bend your hip up that way. Thank you. And back this way. Same for the other leg. Alright. And can you take this leg and go across and the other way? All the way. There we go. Same with this leg. Okay. And can you take this foot and, yep, just like that. And there we go. And can you pull the leg this way? Or it'll go. There we go. Thank you. Put it back. And same with the other leg. And to the bit. And straighten the back out. Go ahead and bring this leg back up again and fight one hand. Okay. And same with the other leg. And then next, can you go ahead and sit up for me? Yeah, I think it's fine too. Let me just move the camera a little bit.
I was gonna say that.
No, well, whatever your heart desires. Okay. So with your neck, can you tilt your head down and back and to your ears to your shoulders? And then turn your head left and right. Okay. Can you bite my hand? Yeah, bite my hand. Okay. Next, for your shoulders, can you put them behind your back and then behind your head? And now can you raise your hand over your arm like this? And now we'll bring them up in front just like this. Thank you. And now put your arms out. And push with my hand. And out the other way. And then for your arms, can you put your arms out again? Like this. Like that. Like this. Like that. Push against my hands. And don't let me push you down. Squeeze tight.
Yeah, that was not a push.
Okay, you good. Wrist straight out. Like this. Like that. Don't let me push. And the other way. Don't let me push. Hands out. Use fingers. Okay. And knee, can you, with the one leg, stick it out and bring it back. Same for the other one. And back. Fight my hand. Fight my hand. Fight my hand. And fight my hand. Here. So can you lift your toes to the sky? And then point your toes down. Point with your toes. There we go. And now can you bring your feet together like this? Oh.
Yeah,
there we go. Alright, let's try this again. Alright, feet to the sky, or toes to the sky, and then point your toes. There we go. And then feet together like this. And then can you put them out like that? There we go. Perfect. Thank you. This wants me to test the strength of that too. Let me go ahead and get you some pillows to sit on.
This bed is super crazy squishy. This may look like something to be up high. Pretty much the same spot.
Alright, and toes up, fight my hands. And now toes down, fight my hands. And then can you stand up again for me? And can you bend down, touch your toes? Try to. There we go, good. And then stand up. And go ahead and just lean. This was probably best. And lean back. Yeah, alright, enough. And now side to side. As far as you can go. Okay, good. So funny. Go ahead. So I don't see it in there, but I know we're supposed to do it. So can you turn this way for me? And take your leg and one leg go back that way. Yep. And then the other one. Elbows, wrist, shoulder, neck, hip. Next up, I'll go ahead and I'll have you. Actually, yeah, we'll sit here because it's going to be easier.
The reflexes?
Yeah, we'll do the reflexes first. Do it a little bit out of order. Go ahead and relax your arm if you can for me. Thank you. Flex this arm for me. The bicep. Thank you.
It hurt your finger.
Can you flex your bicep for me? Go ahead and lift one hand. Lift it. And relax. Make sure you're completely relaxed. There we go. And now we're going to do your elbow. Just make sure you're completely relaxed. This elbow, same thing, completely relaxed. Alright. I feel like we were able to get higher last time.
I'm sorry about
I
that.
know, I know. Alright. Is your leg relaxed? Alright. There we go. Alright. Well, now I'm going to test your sensation. We're breaking out the cotton swab again. So this is what it feels like. You're going to close your eyes and I'll just touch you and you tell me when you feel it. Now I'm going to touch you with the reflex hammer. This will be dull. This will be sharp. So close your eyes and just tell me what you feel.
Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Sharp. Sharp.
We're going to bring out the tuning fork again. I'm going to put it onto bony prominences. Just tell me if you feel the vibration. You go ahead and close your eyes for me. Going to put something in your left hand. Close your eyes. I'm going to put something in your left hand. Tell me what it is.
Temporal.
I'm going to put something in your right hand. Tell me what it is, please. Alright. I'm going to write a number in your hand with your eyes closed. Tell me what number it is.
6.
Alright.
That might have been a fancy 2. Cursing 2.
Oh, yeah. And can you stick your fingers out and close your eyes? Or actually, keep your eyes open. So, what's going to happen is I'm going to move some of your fingers. You tell me, so this will be neutral, this will be up, this will be down. And I'm going to do the same for your toes. So, neutral, up, down. And you close your eyes and just tell me what you feel. Thank you. Next up, we're going to test coordination. So take your arms out for me. And just one note, just like this, fast as you can. And close your eyes. Okay, thank you. And go ahead and open your eyes. I'm going to do the same, but one hand at a time from my finger to your nose. Okay. Thank you. Oh, yeah. You take your hands, do this. There we go, very good. Alright, already did the reflexes, but I did miss one actually. Alright, let me see your foot. Can I tickle?
Doesn't it feel weird?
Yes,
Yeah, I feel that while I saw Togo.
that's actually abnormal. Oh, maybe it's not. As long as your feet don't do that. As long as your feet don't do that, you're okay.
I felt it like up here.
Oh, alright. So that one's done. Alright, I'm going to push on your chest, just bite it. And can you stand up for me? Just put your arms at your side and just close your eyes. Alright, good. Go ahead and sit down. When I had you sit down, stand back up.
Okay.
What I want you to do is come over here, please. And if you could walk that way, just normal. And then turn around and walk heel to toe. There we go. Good. So I'm going to point it down a little bit. Can you do it again just so they can see your feet?
Do I need to walk over?
Yeah, just the same way.
Normal or?
No,
heel to toe?
heel to toe. Okay. Now, on your way back, walk on your tiptoes. Okay, and again, on the way back, on your heels. Okay. Thank you. Well, that was a test. Everything seems to be fine. I appreciate you being my volunteer patient. Thank you very much.
You're welcome.